All right. Well, hello, everyone, and welcome to the HMI virtual information session on the Medical Acupuncture for Physicians course. Tonight, we're going to have it's an hour presentation, and the presenters are, first we have Dr. Mitch Elkiss, who is one of our course co-directors, and we also have Dr. David Groopman, who is our other course coordinator. And then myself, my name is Sarah, and I am the executive officer of HMI. So the three of us will each give a brief presentation. First, we'll start off with a bit about the science of acupuncture. Then we'll go into a little bit more about what the HMI course is like and the course curriculum. And then we'll go through some frequently asked questions about the program. And then we'll open it up to you all for any questions that you'd like to submit. So if you have questions as we're going, you're welcome to enter them into the Q&A section that you'll see on your screen. All right, and without further ado, let me turn things over to Mitch.
Welcome to our virtual information session. My name is Mitch Elkiss. I'm a neurologist from Michigan. I've been practicing integrative neurology for almost 40 years, integrating traditional osteopathic medicine and neurology together. And after 10 years in practice, I needed more, so that I trained in the medical acupuncture program and added that for another 30 years of practice time. And I've been teaching in the HMI program for 25 years to 28 years now, I guess. So it's my pleasure along the way to have been the science link in acupuncture. And as it turns out, the scientific evidence for acupuncture has grown from when I first started teaching, and the NIH Consensus Conference in 1997 said there's two indications for postoperative and chemotherapy-related nausea and for postoperative dental pain, and everything else wasn't very well studied. Now there's thousands of indications, whether you look it up through the World Health Organization, through Medicare, through the Veterans Administration, through the Society for Acupuncture Research, for the American Academy of Medical Acupuncture. You'll see dozens and dozens of evidence-based explanations and demonstrations of the value of acupuncture. So I'd like to present some of the science, and I'll start with the first slide, which shows the beginning context of how we understand acupuncture, was it through the acupuncture points. First slide, please. Oh, excuse me, what is acupuncture? Before the slide about the points, is what is acupuncture? So acupuncture is the use of thin, solid, non-cutting, pre-sterilized, hair-like needles that are inserted at precise points in the body. They're manually stimulated, they're heated, or they're electrically stimulated, and they are used to treat a variety of medical conditions. They are typically combined in the context of medical acupuncture. They are combined and integrated with Western medicine treatments. And in the way we teach it, that's how we consider this, not as an alternative to, but as a complement to. Next slide, please. So the first consideration is what's so special about the acupuncture points that differentiate them from the non-acupuncture points. And number one, they are characterized by a columnar arrangement, almost a chimney of a ascending, emerging from the depth arrangement of lymphatic, arterial, venous structure, and neural structure that are linked to one another and united in this columnar pathway to the surface. And there is a loose connective tissue access to that bundle of vessels and nerves. And it's located in the loose connective tissue around muscles and tendons and ligaments and bones and arteries and nerves in their fascial planes. So acupuncture points are special. They have let me see the next slide, please. They have special electrical conductive properties. They have special innervation properties. They're innervated by the A delta and C fiber branches of the cranial and the spinal nerves. They have a high density of gap junctions at the surface, which makes them very low resistance areas and high electrical conductance areas. So if you were to use an electrical scanner over the skin, you would see the acupuncture points are at the sites of high conductance or low resistance. Some people would even say that there's a growth control model, Charles Sheng, a growth control model that says that the acupuncture points begin at the earliest fascial origins of the human, and as the human grows and the fascia goes from the deep to the surface, the acupuncture points follow and come out to the surface so that they are actually part of the growth control centers. Next slide, please. But in any way you look at them, they're special. They're different from the points around, from the tissue around them. Now, there are different acupuncture approaches. There's classical Chinese medicine and the more modern version, which is called traditional Chinese medicine. There's Japanese style acupuncture. There's French energetics or European derived acupuncture styles. There's neuroanatomic acupuncture, which is very much the, I would say, a dominant practice style in the West. There are the utilization of the 5 phases or the 5 movements. There are the microsystems, which are utilization of projection systems of the brain so that the whole homunculus of the human being can be found on the ear, on the scalp, on the hand, on the foot, and those can be entire treatment systems in and of themselves. They're called microsystems, but many styles there are, but they tend to use the same acupuncture points. Next slide, please. How does it work? Next slide, please. One way we know is that when the needle is turned in the loose connective tissue, it's like spaghetti around a fork. It twists on some of the collagen fibers, and this then pulls on the fibroblasts nearby, enlarging and flattening these fibroblasts. And so rotating the needle contorts the connective tissue, producing a myofascial deformation signal. And this is Helene Langevin's brilliant work. She's now the director of the NIH Center for Complementary and Integrative Health. Next slide, please. And as the fibroblasts enlarge, they release ATP. And ATP, which inside the cell is an energy-containing molecule, outside the cell degrades by dephosphorylation to adenosine. And adenosine produces local analgesia. So that's part of the mechanism of the local analgesic properties of acupuncture, manual acupuncture. Next slide, please. I say manual acupuncture because manual acupuncture is dependent on the twirling of the connective tissue fibers, but electrical acupuncture bypasses that system and is transmitted directly along the perineural fascial transmission network. So again, it's the fascia, whether it's the cytoskeleton and the loose connective tissue fascia or the perineural fascial transmission network, you'll find that fascia is an underlying theme, which is why neurology and osteopathic medicine are great preparatory tools for the study of acupuncture, medical acupuncture. And the electrical current is particularly powerful in affecting the glial cells, the astrocytes, the ependymal cells, not just the neurons. And this is affecting the peripheral, the central, and the enteric nervous system. So this is a powerful effect because it turns out that glial abnormalities, glial cell dysfunction, is one of the underlying pathophysiologic signatures of a number of neurologic, traumatic, stress-related disorders. And it turns out that electroacupuncture inhibits the activation of these microglial cells. Next slide, please. Turns out there's a difference between low frequency acupuncture and high frequency. Low frequency at 2 or 4 cycles per second is slow in onset, generalized in its manifestations, and endorphin dependent. Even if you stop the stimulation, the person still feels endorphinized. High frequency stimulation, different. You can make an area go numb rapidly and segmentally, but as soon as you turn it off, it's no longer numb. And it's mediated not by endorphins, but by the monoamines and maybe the dynorphins to a certain degree. Next slide, please. Some of the recent work by Peter Dorscher has elaborated that the fascia is the way traditionally we reach these points of contact, but the neural system is critical for the working of acupuncture and electroacupuncture, that the peripheral nervous system actually defines the acupuncture points and their channels. And here you can see on the left picture, there's a series of blue dots, which are the inner and outer bladder line on the back of a person, and they correspond with the lateral and medial branches of the posterior spinal nerves. And on the picture to the very left, you see a pink line, which corresponds with the stomach channel, and that corresponds with the anterior intercostal branches, so that all of the acupuncture points in the channels are defined by the peripheral nervous system. You'll see similar demonstrations on the right. Next slide, please. And as it turns out, an intact peripheral nervous system is necessary for acupuncture to work at its best. Nerve injury or an anesthetic block will cancel out acupuncture effects. An intact central nervous system is necessary as well. And sometimes when you're treating a person with a nervous system disorder, a neurological disorder, working on the microsystems close to the brain allows you to bypass some of those irregularities. Next slide, please. One of the developments that's happened recently is the reductionist Western approach has been to take singular points out of the traditional acupuncture approaches and to make them into specific treatments. So here you see the point called spleen 6, which is close to the posterior tibial nerve. And it's called this, along with a superficial electrode, is used for percutaneous tibial neurostimulation, found, again, 3 inches above the body, inches above the medial malleolus. And they use it in Western terms as a place where you can get the foot muscle to twitch, but we know other ways to find it. And this is used for the treatment of overactive bladder. So they've taken away spleen 6 from its understanding in the context of Chinese medicine and reduced it to a singular tool that's manufactured by Medtronic. We have no financial relation with them, and used for and approved and paid for overactive bladder. Next slide, please. This was a big breakthrough in acupuncture when we had live neuroimaging of what was going on inside the brain when acupuncture was taking place. On the left, you see a person in pain, and the white shows areas of lit up on this MRI. And you see that the area of the cingulate cortex and the thalamus are both heavily lit up. In the middle section, especially, and even under the sham, but in the middle section, under true meridian acupuncture, this white activity in the cingulate cortex and thalamus is much reduced. This led to the theories behind the battlefield acupuncture and gave us an idea of how to use live imaging to guide our theoretic application of neuroanatomic acupuncture at a higher level yet. Next slide, please. This even goes so far as to show that people with fibromyalgia have changes in their chemical signatures in the brain. They've got more insular glutamate and not enough insular GABA, that they're in when they're person's in pain, that their default mode network, the part of them that just resonates when they're at rest and normally doesn't include the self-awareness section of the insula, but when there is pain to be monitored, that the insula and the somatosensory cortex are hooked up to the default mode network, and that the worse the pain, the more connected the default mode network and the insula and somatosensory cortex are. And that after successful electroacupuncture, there's decreased insular connectivity to the default mode network. And that correlates with decreased pain. And it turns out, as the current thinking holds, that actually what's happening, this deconnection of the insula and somatosensory cortex from the default mode network is actually normalizing the default mode network. Next slide. So how does acupuncture work? Well, there's myofascial deformation signals, mechanotransduction, there's adenosine, ATP, and purinergic signaling, there's perineural fascial transmission network and neurotransmitters, there's peripheral and central nervous system communication, there's the activation of GABAergic pathways, and there's a parasympathetic nervous system modulation, regulation of the HPA axis, there's brain neuroplasticity, and a whole lot more. So the answers to how acupuncture works are a lot more well understood today than they were 15, 20, 25 years ago to a significant degree. And at this point, I'd like to turn it over to David Groopman to discuss how we can help you learn this material.
Good evening. My name's David Groopman, and I trained initially in internal medicine, then practiced emergency medicine for many years. I took the Helms medical acupuncture course in 1999 and became a teacher of this discipline around 2004. I've had a private practice of medical acupuncture since 2001, so for 22 years now. First slide, please. So medical acupuncture is a singular and unique therapeutic system. It combines the ancient traditions with, as you have just heard, cutting-edge biomedicine. It is holistic, integrative, and complements Western practice. And as Dr. Elkiss just told us, increasingly informed by real-time neuroimaging. And this really was a revelation, I should say a revolutionary moment in our understanding of acupuncture. When I first studied this discipline in the late 90s, none of this was known, and the scientific basis for medical acupuncture was thin. And now it is abundant. So well worth your perusing. Next slide, please. So I thought I'd give you a very brief historical sketch. Turns out that acupuncture was known throughout the ancient world, and perhaps even in Paleolithic times. The idea that there were remote points on the body that could cause reflex effects, modifications of pain or immunity, seems to have been a fairly ubiquitous concept. And using things like bone spicules and obsidian, we know that in a variety of ancient cultures, acupuncture existed. But it was first codified, that is to say, written down in a systematic way, in China about 2,500 years ago in a treatise called the Yellow Emperor's Classic of Internal Medicine, or the Neijing. Over the millennia, it diffused through Asian cultures and went from China to Japan and Southeast Asia. Colonial doctors in the 19th century, when these countries were occupied by colonial powers, these doctors learned from traditional Asian practitioners and brought that knowledge back to Europe. This was, for example, the French in Indochina and the British in China, the Germans also in China, the British in India, and others. In the mid-20th century, French physicians schooled in the Western biomedical paradigm attempted to integrate their knowledge of Vietnamese acupuncture in particular with Western biomedicine. And this was the discipline that our founder, Dr. Helms, was trained in the 1970s. And he created what we might call the North American style, which is a hybrid of a variety of styles of acupuncture that Dr. Elkiss mentioned, including traditional Chinese medicine, French energetics, 5 phases acupuncture, and significantly neuroanatomic acupuncture, which understands acupuncture in terms of the nervous system. Next slide, please. This is an attempt to compare and contrast the philosophical underpinnings of Chinese medicine with those of Western biomedicine, where Chinese medicine is inductive and synthetic, Western medicine is deductive and analytic, where Chinese medicine takes its philosophical underpinnings from Taoism and the Confucian notions of social order. Western biomedicine is Aristotelian and ultimately Cartesian. Chinese medicine always contemplates change, motion, and transformation, whereas Western medicine tends to be static. You have an arm, it has skin and muscle and fascia and bone and vascular system and nervous system, but one does not think of it as being in motion and transformation in the same thought as one thinks of the anatomy. And finally, Chinese medicine is expressed in a pictographic language, whereas Western medicine in a symbolic language. So it's not hard to see how much can be lost in translation, but I would say that the whole is greater than the sum of its parts. In other words, neither of these systems of medicine is complete by itself, but together they are more powerful than either one alone. Next slide, please. So this course requires a conceptual shift, and you may find that you need to suspend disbelief and then verify in practice. This really is an opportunity to learn something new and to assimilate a new system of anatomy and physiology and a new approach to therapeutics, a new way to group systems and disease states and characterology. Very refreshing in that regard. When we say that this medicine is complementary and integrative, this is not just a slogan. So just to give you a couple of examples, one can use acupuncture to mitigate the side effects of chemotherapy, particularly neuropathy, and allow more timely and complete Western therapeutics. One can use acupuncture to minimize medication use in hypertension or in migraine headache. So it's not one versus the other, but it can result in simpler, cheaper, and more easily complied with medication regimens than just using pharmaceuticals. Next slide. So why does the world need medical acupuncture? Well, we do have in our ability to downregulate autonomic tone, unique tools for stress mitigation. And these tools can help you and your colleagues and coworkers, as well as your patients, to cope with the stressors of modern life and modern medical practice. Medical acupuncture is notably low tech. It's low cost, and it can be used in really any medical setting, from downrange military applications and wilderness medicine to the treatment of infertility, to the treatment of chronic pain, to psychiatry, and really kind of everything in between. It's quite remarkably flexible and applicable in all sorts of contexts. Next slide, please. So why is it relevant to the current moment? Well, we have reframed the course and rethought the course to emphasize the pathologies of acute and chronic extraordinary stress, as pandemic stress. And there are some other things that are unique, or at least I should say relevant to the current moment. Our approach to pain management can be extremely effective, and we have demonstrated significant reduction in opiate prescribing in the primary care setting, as well as in perioperative hospital or other perioperative management in surgical settings. We have, as I mentioned, specific therapies for autonomic downregulation and for fatigue states. And if that sounds to you like something that has to do with the management of long COVID, you're correct. So addiction, insomnia, and anxiety are all addressed. Next slide, please. So I thought I'd talk a little bit about kind of the overall plan, and that is comprised of live modules, virtual small group sessions, a comprehensive home study program, and practice, practice, practice. You're encouraged to needle at every opportunity. The live modules are characterized by a combination of didactic lectures alternating with hands-on small group sessions, and we found this to be an extremely effective means of teaching this material. We keep students engaged and current and allow them continuity between live sessions with our relatively new virtual small group sessions. And the home study program is very well thought out and extremely comprehensive. Next slide. So the learning trifecta, which this will have more meaning, of course, when you take the course, but we teach a variety of local treatments for everything from asthma to degenerative arthritis of the knee. But we stress the superimposition of energetic inputs, global acupuncture circulation inputs on top of local treatments. And then we supplement those with reflex somatic microsystems, which Dr. Elkiss mentioned, particularly the use of auricular acupuncture. Our basic thesis of the course is that from a therapeutic standpoint, the whole is greater than the sum of its parts. Next slide. So the live sessions are divided into 3 4-day modules. And in the first module, what we also call the introductory weekend, we teach you some vocabulary and acupuncture anatomy and physiology. We teach current acupuncture science and applied neurology. You've already had a taste of that from Dr. Elkiss. We teach what are called classical energetics, which is to say the theory of acupuncture in terms of how these energies move through the body and how to manipulate them. We put a lot of emphasis on good needling technique and palpation skills, and we go to great lengths to make sure that by the time that you finish this course, you are a very competent practitioner in terms of your manual skills. And in this first weekend, we provide you with a variety of specific treatments for stress, pain, and fatigue and injury. And the result of this is that when you leave the introductory weekend, you will already have a highly practical set of techniques that will be immediately applicable in your practice. And that's a kind of an exciting thing. You'll have things that you can help people with for stress, pain, fatigue, and some other problems. Next slide. In the second module, we go deeper into acupuncture systems. We talk about the psychospiritual and energetic tools that are available in acupuncture. We introduce you to the concept of the structural biopsychotype, which is, to make a long story very short, a sort of an expanded conception of characterology and something you already understand a little about, endomorph, ectomorph, and mesomorph, but it's much more thoroughgoing and specific, and really very, very interesting. You will learn an expanded group of treatment options for pain and more advanced auricular acupuncture techniques. In the final module, we integrate and refine the skills that you've been taught, and we put a great deal of emphasis on acupuncture treatment design, acupuncture diagnosis, and strategies for clinical work. We also provide you with our more advanced, complex, and highly refined treatments, which we might call the workhorses of medical acupuncture. And we do a number of patient simulations to try to approximate the clinical experience. Next slide. So, in summary, the course is very practical. It's refined, and it's been distilled over about a 35-year period. We're constantly trying to improve it, reevaluating it, and trying to make it better. It's quite learnable, and I think most students would say quite enjoyable, although quite challenging as well. Medical acupuncture is a full medical discipline, and we really are excited to share this with you and hope that you will be interested enough to check us out further and attend our course. And with that, I'll turn things over to Sarah.
All right, thank you very much, Dr. Groopman. All right, next on our list this evening is going through some frequently asked questions. So you've already heard a little bit about the science of acupuncture and about the HMI program, but we're going to go through a series of commonly asked questions. So the first of which is, how is the HMI course structured? And Dr. Groopman talked a little bit about this, but the course is presented in a hybrid learning style. So there's 3 different learning categories. There's 3 modules of in-person instruction. In between those, there are virtual small group meetings. There will be 3 of those in between each of the live modules. And then there's also self-paced home study, videos, readings, and quizzes, which total up to about 6 to 8 hours per week of those home study activities. The next question is, when is the deadline for enrolling? So this course, the Medical Acupuncture for Physicians course, is accepts students on a rolling basis. The class very often fills to capacity, so we certainly encourage early enrollment. Your spot in the course is secure when your entire enrollment process is completed, which means your tuition is paid and all of your enrollment documents are completed and signed off on. Something to keep in mind is there is a late tuition fee if your tuition is paid less than 30 days prior to the course beginning. I will say, though, that it is possible that the course can fill to capacity before this late fee date. So if you're interested in taking the class, again, we really recommend getting your application in early and getting your tuition paid early to make sure you can secure your spot in the course for whichever cohort you're most interested in. The next question is, can tuition be paid in installments? So I'll say first, the very best tuition rate you can get is when tuition is paid by a single check. There is a check discount. You can also pay your course tuition easily by credit card, either online or over the phone with our staff at the office. If you are interested in paying in installments, we do offer both a 2-part payment plan or a 3-part payment plan, and those can either be done by check or credit card. And we just ask that you get in touch with us if this is something you're interested in arranging, and we can share a little bit more about the details of the timing in that process. All right, the next question is, when does the HMI course begin? So we run two cohorts every year of the same program. One cohort will start in the spring, and it spans from the spring to the fall, typically starting in March, and graduation is in September. This cohort typically has in-person modules on the eastern side of the country. Currently, we're running those programs in Potomac, Maryland, which is just outside of Washington, D.C. The other cohort begins in the fall, and it spans from the fall to the spring, typically starting in early November and finishing in early June. And this cohort has in-person modules on the western side of the country. Currently, we're running those in Tempe, Arizona, which is just outside of Phoenix. Something important to note here is that HMI is the only training program with a course that's offered 2 times per year, which is important. If for some reason a conflict comes up, work life, personal life, sickness, whatever the case may be, if a conflict comes up while you're mid-course and you need to reschedule to the next cohort for one of the units, you don't have to wait a full year. Because we run 2 cohorts a year, we can push you back just to the subsequent cohort, which typically means you only have to wait about 6 months to continue on with your progress rather than a full year, which is really, really nice to keep your momentum going and to not kind of lose steam over an entire year. The next frequently asked question is, what are the differences between the 2 cohorts? So in terms of curriculum, it's the exact same curriculum for our East Coast and our West Coast cohorts. The 2 pieces I'd say to keep in mind when you're deciding which cohort to enroll in, firstly, think about the dates. So the cohort that starts in the spring and goes spring to fall will require those small group virtual meetings and all of your home study work to be completed over the summer. So if you tend to have a really busy summer, that might not be the best cohort. If you tend to have a really open summer and you have time to add more things, that might be the best one for you. In contrast, if you're interested in doing the cohort starting in the fall and going fall to spring, keep in mind that the first half of the course is going to be over the holiday season. And so again, depending on what your schedule is like, trying to fit in virtual meetings and home studies over the holidays may or may not be challenging for you. Those are just considerations as you're thinking through these 2 cohorts. The other piece besides the dates are just in terms of location. So the East Coast program is based out of a retreat center in a more quiet residential part of town. The West Coast program is currently in the Tempe, Arizona city itself. So it's an urban location and it's sort of a college town. So you get that college town urban feel to it. So they both have pros and cons. It's really more a matter of what is working best for you in terms of dates and locations. The next question is, can I take the modules out of sequence or can I enroll just as a standalone single module? The answer to both those are no. So all 3 modules are required when you enroll in the course, and you need to take all 3 modules in the designated order. So as Dr. Groopman talked about, the course from module 1 to module 2 to module 3 really builds upon itself. So it's essential that you complete each of the 3 modules in the designated order. In terms of enrolling just as a single standalone module, as a graduate of the HMI program, you are eligible to enroll for a standalone individual unit, but as a new student, you need to enroll in the complete full course. The next question is, what does tuition include? So tuition includes a lot. First of all, it's 300 hours of CME credits upon successfully completing the course. This includes the 3 live course modules, plus the virtual small group meetings in between with preceptors. While you're at the live course modules themselves, tuition includes breakfast, lunch, and snacks throughout the day, as long as you are booking your lodging within the HMI room block. And that's for all 4 days of the course, spanning over the 3 live modules. You'll also receive 4 textbooks, a nice big course syllabus, and other reference materials. You'll be given a number of pieces of clinical equipment. You will be given access to the HMI video library, and you'll also be given a starter kit of needles to get your practice going. So after all of that, the only other additional costs for individual students will be travel, whether that's flying or driving to the 3 live modules, your evening lodging, plus dinners at the in-person courses. And then once you get through your initial starter kit of needling supplies, you will be on your own to continue purchasing whatever needles you're going to be needing for your clinical practice. We provide all needles for all 3 modules of the course itself, but anything you need for your own practice at home, you'll need to purchase those needles. The next question is, who is on the HMI faculty? So besides Dr. Groopman and Dr. Elkiss here, who are course directors, the HMI faculty is composed of only physician medical acupuncturists. So we do have one dentist as well, who's on our staff. All the faculty members are graduates of the HMI course, and they've also graduated from our internal preceptor training program. In order to even start our preceptor training program, and definitely to graduate from it, it means that all the preceptors you'll be working with have extensive experience in the clinical practices of medical acupuncture, in advanced theories of medical acupuncture, and experience in teaching, mentoring, and lecturing. And as a student in the program, you will work with a wide variety of preceptors. So you don't just work with one, you're going to work with many, many, many. One of the really important pieces of our program is that when you're on site at the live modules with us, all the clinical activities you're going to do are done in small group settings with a really low learner to preceptor ratio. So typically that's 6 students to 1 faculty member at the most. And this low learner to preceptor ratio really ensures that every individual student is closely supervised, and you're also given the ability to start building relationships with the HMI faculty members, who are great resources. The next question here is, what are the license requirements to practice medical acupuncture? So the short answer is that regulations vary state by state, but for most states, you can practice acupuncture under your medical license. And this is really important when you're looking up your own state regulations, that you want to look up regulations for how you practice under your medical license. Some states require a certain number of training hours. This can vary from 200 hours, 250 hours, or 300 hours for physicians. Other states do not define any specific training hour requirements. You just need to be trained in order to practice. The HMI course is a 300-hour training program, so you'll be covered no matter what the state hour training requirements are. There are a handful of states that do require you to register with the state medical board after you complete the required training hours. They're listed here. Essentially what that means is when you finish the program, you'll receive your certificate, and you'll just need to submit your certificate and some additional documentation to your medical board. And we can certainly help with any of those pieces that you'll require us to sign off on. Now, there are a few exceptions. The one big one is Hawaii. So Hawaii does not allow the practice of acupuncture by physicians under their medical license. So it doesn't matter how many hours of training you do. As a physician in Hawaii, you cannot practice under your own medical license. You'd have to go get a different licensed acupuncture degree. Now, the caveat to this is if you are practicing in Hawaii in a military or a VA setting, they do follow the federal regulations, which is to complete 300 hours of training. The second exception here are New Mexico and Montana. Both of these states have somewhat vague regulations, and we really recommend that you reach out directly to your medical board if you're in either of these states for further clarification to ensure that you're following the regulations appropriately. And then just to clarify here that this information is specifically for MDs and DOs. If you are a nurse practitioner or a physician's assistant, we do recommend that you get in touch specifically with your state nursing board or your state physician assistant governance before enrolling to confirm whether or not this course will meet your own training requirements. Again, they vary state by state. Some states, this course will be fine. In other states, you just won't be able to practice under those degrees. So definitely, make sure that you are following your state guidelines. Get in touch with us if you want to talk about your specific situation, or definitely get in touch with your state regulatory board as well. Okay, the next question here is, can I bill insurance for acupuncture, and are there specific CPT codes? So the short answer is yes. There are 4 different CPT codes that can be used for billing and coding related to acupuncture. And during the course in our second live module, we'll have a practice management panel where we discuss all of the billing and coding and different practice management topics really, really thoroughly. The next question is, how do I enroll in the course? So if you're ready to enroll, it's a pretty straightforward enrollment process. So there's 3 steps. The first step is to fill out the online application that's found on the HMI website. It's mostly demographic information, so really it's quite straightforward to fill out that piece. Then there's a few pieces of supplemental documents that you'll need to submit as well. So those include your CV or your resume, a brief personal statement, just giving us a little bit more information about your interest in taking the class and what you're hoping to get out of it, and then a copy of your medical license. We do require that every student enrolled in the course has an active medical license. So a copy of this license needs to be turned in as part of your enrollment. And then step 3 is finalizing your tuition payment. And as I mentioned before, we are reviewing applications on a rolling basis. After steps 1 and 2 are completed, so after you've done your online application and submitted your supplemental documents, we typically will review all of that information within 48 hours and send an acceptance letter if everything looks good. For step number 3, finalizing your tuition payment, your spot in the course is secure once that tuition payment has been finalized. And also, once your tuition payment has been finalized, we can give you access to the pre-course assignments. So before the course even starts, there are a few reading and video assignments, and we do need tuition to be finalized before we can give you access to those. But otherwise, it's 3 pretty simple steps, pretty straightforward. And again, with that tuition payment, if you are interested in doing a payment plan, those are available, and we just ask for you to get in touch with us to go over those details. Briefly here, I just wanted to show you a screenshot of what the application looks like so that you're familiar when you see it online. It is mostly demographic information, so it'll take about 4 minutes to fill out. All right, and then finally, this is the last of our frequently asked questions. What makes the HMI course special? So there's a number of attributes of the HMI program that we wanted to highlight with you all tonight. The first of which is that HMI teaches the most extensive variety and immediately applicable array of acupuncture techniques. So as both Dr. Elkiss and Dr. Groopman talked about, there's a variety of different styles of acupuncture. And something special about our course is that we really integrate all of them. So there's more of the Chinese style of acupuncture, there's the French energetic style, there's microsystems, and there's neuroanatomic applications. So you really get the best of all the worlds in the HMI program by getting experience with really a wide variety of different styles and techniques. Another piece that's especially exciting for the HMI program is that our course has the greatest number of in-person training hours. So those live, hands-on, you're working side by side along with your fellow students and your preceptors. And this piece is really critical in gaining competence in the techniques of acupuncture. And so we put a strong focus on having those in-person training hours. And our program does have the most number of training hours. Another piece here is that the teachings in the HMI program are designed to be a bridge so that your skills that you're learning in the course can be integrated into your already established medical practice. Our goal for every student here is to enhance, not to substitute your current practice. So we're really blending the Eastern and Western medical views so that you can become a better doctor, not to totally switch gears. We really want to enhance what your current practice is by adding these new skills and techniques and really the thoughts and attitude about medicine. Something else that's special is that the HMI curriculum is developed specifically for the advanced medical provider. So everyone in the class is going to have experience in advanced medical training. So whether you are an MD or a DO, we also do invite residents to enroll in the class as well. If you're a resident and you can manage to find some time during your residency, that is also certainly allowed. And then also if you're a nurse practitioner or a physician assistant, but it's nice to be in a course where you see that everyone else around you is coming in with that advanced medical knowledge and all speaking the same language and starting at the same sort of prerequisite point. Another piece here is we have a really deeply experienced and knowledgeable preceptor teaching team. Every one of our preceptors is really fantastic. You're in great hands with each and every one of them. Something else that's special with HMI is that we do provide intermediate level course offerings, and HMI graduates are granted access to our own alumni activities and different levels of HMI support after you finish this introductory class. And finally, the HMI schedule, as I talked about before, we offer 2 different cohorts each year, and this scheduling flexibility is really a nice perk, just in case something comes up that we're able to kind of keep you going without having to wait a full year before taking the next live module. So there's a number of pieces that are really unique and make the HMI program a really, really special course to take. And at that point, that is the end of our presentation that we wanted to go over with everyone. What I'll say at this point is, if you have additional questions, we're happy to take the next 10 minutes and answer any individual questions. There is a Q&A box down at the bottom that will give people a few minutes just to put in some questions. If you have questions, whether it's about acupuncture itself, about the HMI class, about enrollment, or anything you have questions on, we're happy to take the next 10 minutes to go ahead and answer those. So we'll just give it a minute here to let any questions flow in.
I want to know what makes you all be here. What brought you all here tonight? So that's interesting to me.
All right, let's see. We have a first question has come in. The question is the spring and fall cohort the same duration, about 6 to 7 months? So yes, both cohorts are just about the same The spring cohort starts typically towards the end of March and finishes towards the end of September, so about 6 months. The West Coast fall cohort begins in early November and finishes in early June. That's 7 months. So between 6 and 7 months for both cohorts. They're really, in terms of the course itself, they are very, very identical between East Coast and West Coast, between the spring and the fall.
And at the end of that course, you will be masters of the introductory material. You won't be masters of everything in acupuncture, but you will have a mastery of the materials at the introductory level that will enable you to be able with your patients in many ways.
The next question here is, with the application screenshot that I showed, can you apply for the spring to fall? We enroll for one cohort at a time. So currently we are enrolling for a course that starts in early November, and that's going to be the fall to spring cohort. When we are finished enrolling with that class, which will be kind of mid-October, unless we fill the capacity earlier, at that point, then the next cohort application will open. So if you're not ready to take the class this fall, but you're interested in signing up for the subsequent one in the spring, make sure that you are on our notification list, that you're getting our regular emails, and we will notify you then by email when we're ready to open up enrollment for the next cohort. But as I said, we do only enroll one cohort at a time. So at the moment, we're enrolling for the cohort starting in November. And I'd say kind of mid-October, probably, we will open up enrollment for the subsequent cohort. All right, the next question that came in, maybe we'll have Dr. Elkiss answer this one. Is there an acupuncture board certification process that we can pursue after this course?
Indeed, there is. There is an acupuncture, American Board of Medical Acupuncture, which is related to a connected but not identical agency called the American Academy of Medical Acupuncture. And this allows board certification at the level of diplomat and fellowship. And it's important as a way of noting your steps along the way, and also a way of demonstrating your certification, and also a way of gaining later content to further your acupuncture career with the camaraderie of the American Academy of Medical Acupuncture.
And also, it can increase your legitimacy with hospital credentialing boards and other sort of authority providers that are comfortable with the idea that you have achieved board certification. More specifically, it requires you to have seen about 500 cases over a 2-year period, as well as sitting for a comprehensive and rather fair board certification exam that's a half a day affair.
All right, the next question that came in is asking a little bit more about what the weekend schedule looks like. So each of the live modules are scheduled starting on a Thursday and ending on a Sunday. So the Thursday that the course begins, we start right on the dot at 8 a.m. So we highly, highly, highly recommend coming in the evening before. So flying in or driving in on the Wednesday before every class. There have certainly been cases where people fly in on Thursday morning and their flight is delayed, and they've then come and missed the first 3 hours of the day, and it becomes quite difficult to catch up because we're going to start right away at 8. So we recommend coming in on a Wednesday and then staying Wednesday night, Thursday night, Friday night, Saturday night. So 4 nights. The class and this is true for all 3 live modules, the class will end on a Sunday at noon. We're very good about ending at noon. We are not going to hold you over. And so typically students will fly home or drive home Sunday right after class. So it is 4 nights of staying in a hotel, and then kind of 2 days that you need to take off, Thursday and Friday, and then the 2 weekend days, Saturday and Sunday. But you'll be home again by Sunday evening. It's a busy 4 days though. We certainly take advantage of the time that we're together, but we stick very strongly to a schedule, so we're certainly not going to hold you over late on that final Sunday. And let's see, one other question that came in here is, do we already have dates for the next cohort? Yes, so you'll see on the website right now that actually currently the only dates published are for the class that we're currently enrolling for. I think we did just finalize dates for the spring cohort that's starting this upcoming March, and those should be published on the website later this week if you want to take a look for those. But we will be starting that next cohort in kind of mid-late March of next year, and that will go from March to September. All right, any last call for any last questions here?
Any other questions?
2 more minutes. Happy to answer any questions you have.
Okay. What do you want to know about us or our course or acupuncture? We're really glad that you came this evening to try and understand more about how to learn acupuncture, because we're deeply invested in the teaching of acupuncture. That is what we spend our energy working to do better all the time. And we're grateful for your showing up tonight.
This really is a remarkable course, and of course, we're biased and we have a vested interest, but I think most students who take the course would agree that it is a special experience. And we all, it's challenging, but we really do have a lot of fun, and it's taught in a joyous spirit. And we encourage you to give strong consideration to taking our program.
All right, well, I think probably at that point, let's see. All right, one final question has come in. We'll get this one answered and then we'll call it a night. The question is, where will the spring class be held? So we currently run our spring class in Potomac, Maryland, which is just outside of Washington, D.C. It's at a site that's called the Bulger Center. We've been there for a number of years. And so those details will be published, as I said, I think later this week with the finalized dates, but it will be in Potomac, Maryland, so just outside of Washington, D.C. there. All right, and I think on that note, we'll call it an evening. If you have any other questions that come up, you are more than welcome to reach out to HMI staff either by phone or by email, or there's a place to put questions in on our website, and we're happy to get in touch with you to talk through any regulatory questions you have, or questions about the course, or questions about acupuncture. And we appreciate your time coming here tonight and really look forward to having you in class one of these days.
Thanks, everybody.
Good night.
Good night. Thank you so much.